When Leon Christensen was 65 years old, he suffered a brain bleed. For 4 days, he lay undiscovered in his apartment until concerned neighbors, noticing a smell, called for help. Rescuers thought he was dead and took him to the morgue before realizing he wasn't.
I wasn't dead. I was unconscious, barely existing dead. I mean, I still had a breath, but not much.
Christensen's story, although rare, is a sobering example of the social isolation elder orphans face as they grow old without support. While it's hard to know the exact number of people who fit into this category, it's estimated that around 101,000 people over 65 live alone in San Diego County. That's about 1 in 5 seniors. Christensen is 82. He never married or had children, although he said he came close a few times. It's been more than 20 years since he's seen any family.
I still have my second, third cousins, and such, but they don't live on the other side of the country. And last time I saw them was at my mother's funeral back in 2002, and I haven't heard from anyone since.
Dr. Ellen Lee is a clinician and researcher at UC San Diego Health. She's studied the epidemic of social isolation and loneliness and sees a steep increase in older adults. She attributes to rising rates of childlessness, lower rates of marriage, and the aging of baby boomers.
So when you get older, the risk factors for becoming more likely to be isolated or alone are increased. Like you're more likely to lose family and friends and significant others as they pass away. You're more likely to become more frail and less mobile. So you're going to be more dependent on people whose support you may or may not be able to access. So we do think that those rates are rising. How much is difficult to say.
Lee says elder orphans often don't have people to help them with functional support, simple tasks that are harder to accomplish as we age.
Like people to help you get groceries, people to help you get medicines, people to drive you to the doctor, versus even having like an emotional, intimate relationship, sort of that emotional support.
She says it's challenging for clinicians to identify these individuals, making it difficult to manage the complexities involved in delivering care, especially if they don't volunteer the information. After his accident, Christensen was left mostly paralyzed. He still has use of his left hand, but needs a motorized wheelchair to get around. He's also legally blind and can only see shapes. He relies on caregiver support twice a week for a few hours. They help him with grooming, making meals, and sorting medications.
You better have an apple.
Okay.
They represent family to me.
Christensen lives at a senior residence in the East Village of San Diego. He said he's not the only one living there alone.
Of the individuals that I know here, at least 6 of them have no other immediate family except us.
Research has linked social isolation and loneliness in older adults to higher risks for a variety of physical and mental conditions, such as high blood pressure, heart disease, depression, and cognitive decline. Paul Downey is CEO of Serving Seniors, a nonprofit organization that helps low-income elders in San Diego.
We see a significant number of people that live alone, that family either isn't there, they're estranged from, but they're by themselves. And so they have to cope with everything, and not just medical issues, but they don't have anybody to talk to.
He says economic insecurity may add another burden to orphan elders, with 19% living on about $1,500 a month in San Diego County. At his senior center, the number is much higher.
For us, our biggest challenge is 86% of our seniors live below the federal poverty level, which means they are right on the cusp of homelessness.
Experts say senior centers play a critical role in addressing this epidemic of loneliness by cultivating social connections. Whether it's a place to share a meal, take a fitness class, or simply engage with others, senior centers can be a lifeline to many older adults who live alone. Downey says the community also plays a vital role.
If you have an older adult neighbor, go check on them. Stop by and say hello. Bring them a cup of coffee. Go out of your way.
For Christensen, his brush with death has given him a new perspective on aging alone.
I'm quite happy with being a orphan. Because I have survived death, I think every day is a good day.
He keeps an open door policy so he can wave to friends as they pass by the hall. Heidi DeMarco, KPBS News.